Patients at Helen Joseph Hospital took to social media to express his sad experience, right? Imagine going to a hospital where you're fighting for your life only to be met by disrespectful doctors, by disrespectful staff. And here you are fighting for your life. No one is communicating with you, right? And you, at the same time, you are faced with resources that are literally just not working, or other facilities that are not working. A person being left unattended because doctors just do not care. I do have a clip of this gentleman explaining, right, and taking us a little bit around the hospital and giving us more info on his experience as well. Hello, hi, welcome to Entertainment's Galore, and this is your girl Missy. Please do like this video and subscribe to the channel if it is your first time here. If you are a returning subscriber, thank you so much for tuning in. After this video kind of went viral on X, Departments of Health did come out to say that they are investigating, and apparently about 9 months ago they launched a provincial campaign saying that you serve with a smile, something like that. My concern is that why, okay, is social media doing work for these departments, for these ministers? The only time that they start really hitting the ground working, from what I have seen, is when X is like going viral on something. Okay, then like, okay, we on it, we doing it, and then they're gonna call media houses to come and cover, all right, the fact that they're actually working, which is really really sad, because for years health facilities in South Africa has literally been running down, and I'm talking about the public hospitals, the public clinics, okay? Not only just the facilities, not only just the resources, or rather not only just the facilities, but also the staff as well, the nurses, the doctors, and not all of them, but they are disrespectful. They are disrespectful. They literally just don't care about caring for a patient. They don't show any care. Imagine you sick, you're fighting for your life, you need help, you need a nurse, you need a doctor, and then you just literally met by somebody who has no care in the world. All right, and then you're not even sure if you're actually gonna be better. I mean, there's even some instances where people have gone into hospitals and have left sicker than they were, or probably lived with like other sicknesses that they got while they were in hospitals because of the conditions there. Okay, the not so working facilities as well. It's disgusting. It really is disgusting.
They treat the patients like cockroaches. No doctor, I haven't seen one doctor walk up to a patient in our ward and go, "Good morning, Mr. So-and-so, how are you?" Nothing. They treat the patients with absolute disdain and disrespect. I'm talking about this from the young Wits medical students all the way up the chain at this hospital. I have never seen a level of disrespect for human beings like this in my life. Yesterday I was taken down for a CT scan to check if I've got cancer. I had the CT scan, I was brought back up. A few hours later they came back, said, "Oh, we made a mistake, we forgot to put the dye in you." So I went down and had another CT scan. Now, I've been dealing with my doctors, Dr. Pillay and Dr. Van Eck. Every day they come and report back to me, they tell me what they're doing. Yesterday, a blonde doctor, some young blonde white doctor, she comes to my bed, looks at me, ignores me, starts writing in my file for 10 minutes, says absolutely nothing, and then announces that Dr. Pillay is no longer my doctor, I've got a new doctor. I asked why, and she said that he has handed his patients over to less complicated patients over to someone else. And she gave me the doctor's name, I can't remember. I haven't seen that doctor for 48 hours, so now I haven't had a doctor for 48 hours. Dr. Pillay, I don't know, Brew, you came and spoke to me every day. Just 2 days ago you said we're going to look awkwardly at each other for the next few days until we have your CT scans, and now you've ducked. Someone told me that you're writing exams at the moment. I don't know. Right? The guy opposite me, that doctor that comes every day, treats him with absolute disrespect. He's a human being who, when he talks to this guy who is in constant pain opposite me, he talks to him like this. The guy opposite me goes, "I'm in so much pain, doc. And the doctor goes, oh yes? Just like that. Nothing. Nothing. No doctor here calls you by name. Every doctor here assumes you're a hobo that's come off the streets. The doctors here are behaving like the patients are their little experiments. I've never, ever experienced anything like this in my life. I'm going to take you into the ward, and I'm not going to say much, but I'm going to show you some of the crap that's going on in this ward. Give me a second. Let's go to the ward. Oh, by the way, I'm lucky to be talking to you on this phone, because last night as I was sleeping, a woman came into the room, took the phone from right next to my head and stole it. Luckily, the guy opposite me saw it, woke me up, said, Tom, someone's just stolen your phone. I got another guy to call it, and I heard it ringing from down the passage, and I tracked her down to a ward where she was trying to remove the SIM card. So I'm very lucky to be talking to you on this phone. Let's go into Ward 8. The doctors here, you give doctors a bad name. All of you. Despicable human beings. Right? Here. Taps. What, do you think it works? Nah, that tap doesn't work. Let's check the ceilings out. Well, they're peeling and flaking and stuffed. Right? All of this is rusted. This is my bed. The plug doesn't work, it's blown. That's all rusted. I am so angry with you. This is the Helen Joseph Hospital, where doctors experiment on you. Now, earlier on, I put a video up of the guy opposite me who was busy dying. I'm going to turn this camera around, right? He's dead. He died 20 minutes ago. He's lying there in that bed. He's actually gone. He's dead. Now, our government wants us to believe that the NHI is going to do great things for us. But here's just a few minutes in the day in the life of the Helen Joseph Hospital, where the doctors talk about their cars and their clothes and their bonuses while people lie dying in front of them. When the doctors left the ward now, after this guy just died, they were laughing. Shame on you. Shame on you, Helen Joseph Hospital, but mostly shame on the doctors that think they have the right to call themselves doctors, that run around this hospital and treat every single patient like a cockroach. You, doctors, you're the cockroaches. You actually don't deserve to exist. Not the patients you're busy experimenting on and killing. Please share this video so people can see the state of South African healthcare. If this is what the NHI is, make sure it doesn't happen.